Hello, my name is Alice Munyua. I am a nurse practitioner, and today we're going to talk about schizophrenia. Schizophrenia affects quite a number of people, and it is a really serious mental health disorder in which people have an abnormal interpretation of reality. Schizophrenia is extreme disorderly thinking. And I did a video on psychosis. So schizophrenia is a little bit more complicated than psychosis. But there's still some of the symptoms that you see in psychosis, you can see them in schizophrenia. But schizophrenia is actually very disabling. Most people never get better. Most people have to stay on medication. And they kind of don't understand exactly what causes it, but we're going to take a deeper look at this disorder and see what could actually be wrong. The signs and symptoms of schizophrenia. You see the same signs and symptoms in psychosis. You also see them in schizophrenia. So the delusional thinking. That is the belief in false beliefs. That's what they call them, and that's why I actually hesitated when I say that, because people call them false beliefs, but and they also tell people that they are not in touch with the reality. But really, who decides that you're not in touch with the reality? Are they in your mind to know what you're looking at and what you're thinking? They can't do that. Hallucinations is also common with this disorder, and this is where people hear things and see things that don't exist. That's what our textbook says. But who says that they don't exist? When I went through psychosis, I told you that God made unseen things and seen things. And when you're looking at things through the spiritual eye, you can actually see the unseen world. So when somebody who has schizophrenia tells you that they're hearing things, and just because you can't hear them, you assume that they're not really there or they don't exist, who's that to decide? If they say they're healing things, we should always believe them, because it is real. As somebody who actually went through this, I did not have schizophrenia. I actually had psychosis. It was acute psychosis, and I explained in details in the video named Psychosis. So if you haven't seen it, please go back and look, because I explained the kind of things that I was seeing and what I was hearing and what I was sensing, and I documented everything. And I also explained what was going on, because once I went through that, I was able to understand mental illness at a deeper level, because I went through it. So the disorganized thinking is also there, but the disorganized thinking comes from the delusions and the hallucinations, because people are receiving information through many ways. Some of it is coming through the sixth sense, which is the spiritual sense. And if somebody says they're seeing something, we really should listen to what they're saying, but not tell them that they are delusional or they are hallucinating, and tell them that these things don't exist, because they really do exist. So the other thing that you see with schizophrenia is negative kind of symptoms. That's inability to function normally, social withdrawal. They also lack ability to feel joy. Like, joy is really lacking. Sometimes they can be happy, but joy is a spiritual product. Joy and happiness are not the same, but with schizophrenic people, you'll find that they actually some of them have inability to feel joy. There is also self-neglect, not bathing or cleaning up. That was not one of my problems. When I went through this, I was bathing. The other thing is trouble sleeping, which you can also actually see it with psychosis. And I mentioned about trouble sleeping in psychosis. I mentioned about trouble with sleep in bipolar. I mentioned about trouble with sleeping in people who have seizure disorders, and now trouble sleeping with schizophrenia. And trouble sleeping, when somebody is actually having trouble sleeping, they are dealing either with too many thoughts that are keeping them up, or they are dealing with a spiritual problem. It's either a spirit that is preventing them from sleeping, or it's their thoughts. But if it's your thoughts, thoughts are also spiritual in origin. So in schizophrenia, you also see depressed mood, sometimes lack of motivation, and sometimes you also see anxiety disorder. So it's like you see the whole gamut of mental illness with this disease. But the delusions and the hallucination is really the true hallmark of this disease. Now, complications of it. Some people can commit suicide. You also see suicidal thoughts coming in with this behavior, with this disorder. You see self-injurious behavior, like people injuring themselves. You see, I already mentioned the anxiety disorder. You also see obsessive compulsive disorder. You also see substance abuse with this disorder. You also see inability to either work or go to school. Obviously, when you're in this state of mind, it is very, very difficult for people to go to school or maintain a job. Sometimes with schizophrenia, you might see aggressive behavior, but it's not everybody who has schizophrenia really has that. But sometimes you might see it. Now, the treatment for this disorder, usually the treatment is based on, because it's treated by psychiatry, is based on thoughts, mood, delusions, hallucinations, substance abuse, violence, or suicidal behavior. If anybody has any of those, you will find that they will be put on medication, so in order to treat thoughts. Okay, I'm still continuing with this disorder. If you look at everything I've mentioned, that is everything that happens in the mind. So schizophrenia requires like a lifelong treatment. Most people who have this disorder will be on medication for the rest of their life. However, when we take a deeper look at schizophrenia and the causes of it, I don't think people really understand what causes schizophrenia. The causes of it kind of remain elusive. Some people think it's a genetic problem because it tends to run in families. Other people think it's a biological problem. Other people think it's a psychological problem. People think it's an environmental problem. But really, when you look at the name itself will give you a clue what is the problem. So let's dissect the name, schizophrenia. Schizophrenia is a combination of two words. There's the word schizo, which is a root word, and it's a Greek word meaning something that has been divided, something that has been cut, something that has been separated, something that has been split. So that is the root meaning of schizo. So let's look at phrenia and see what phrenia really means. So phrenia comes from, sometimes you hear people referring to the phrenic nerve, and this will tell you that if the phrenic nerve is split, there is some kind of emotional problems going on. But phrenic or phrenic nerve actually comes from the root word, which is phrenia. And what is phrenia? What does phrenia mean? Phrenia is something that is either relates to the brain or to the mind. And this is where the problem is. We know that when we do MRIs on people who have schizophrenia, sometimes you might see their brain is a little bit damaged, but at least it's not split. You know, it's not divided. Part of it is not missing. Sometimes you might do a brain MRI or a brain scan, and you see the brain is normal. And still, they have this disorder. So, but when I look at our textbooks, I also notice another big, huge problem that's there. They tend to use the textbook, or whoever wrote it, they tend to use the mind and the brain interchangeably, as if they're one and the same thing, and actually they're not. So when we talk about schizophrenia, we're actually talking about a split mind. Now, if you think about what the mind is, stop thinking about the brain for a minute, because the mind and the brain are two different things. Think about the mind. What in the world can cause the mind to split? That will give you a clue what the problem is here. The mind is not a physical thing. the mind is the first part of the soul, because your soul, which is your mental body, which we really cannot see, it's your mind, your will, and your emotion. That is the soul. So the soul of a human being. And now here we are talking about a spirit mind. What in the world can spirit the mind? When we talk about a mind being spirit, the only thing that comes to my mind about this is actually something like either a broken mind, a shattered mind, and the only thing I can think of is extreme physical trauma, or extreme emotional trauma, or extreme spiritual trauma. Because sometimes you will find people sustaining a broken mind when they do some questionable spiritual practices. Either they do it without a guide, or they are on a really, really serious spiritual path, and they get in trouble with the spiritual world. And the things, because the spiritual world has angels and demons. Here I am talking about demons again, but I have to talk about them in order for you to understand what I'm talking about. And the demons, they are not nice. So when you go on a spiritual path and your mind opens up, you will be able to encounter some of these beings, and they are not nice, and they can terrorize you. And when they terrorize you, that is called spiritual warfare. And if you know anything about spiritual warfare, or if you have ever experienced this, I have, so I can talk about it. Spiritual warfare, when people are dealing with it, there is nowhere to hide. You can't go lock yourself in the house and expect to be free from spiritual warfare. You can't go under the bed and expect to be free. You can be tormented. And when spiritual warfare is directed at you, there is nowhere to hide. And nobody can help you with it. And so this actually can break people's minds. But for most part, the thing that breaks people's minds is actually trauma. And trauma is so common in our society today. Trauma is so common in our world today. And this is not just any kind of trauma. It's usually extreme, extreme trauma. People go through this when they are young, and most of the time it happens in the hands of people who should be taking care of them, like their parents. Sometimes it's spiritual leaders, people that they trust. And is usually carried on for an extended period of time. Now, when this kind of trauma happens to a young person, it's very, very easy for them to have a broken mind. So, and the only cure for a broken mind, which is, in my opinion, that is schizophrenia, is actually not medication. Now, I do support medication if somebody is being aggressive, or if somebody is not able to sleep, or if somebody is suffering from anxiety, because they have to calm down in order for them to do what they need to do, to understand what's really going on. But on top of that, they need the actual treatment for the trauma that they went through. Their mind has to be integrated. Their mind has to heal. And in order for it to heal, you have to go through counseling with somebody who understands the spiritual needs of a human being. And right now, we don't have many people who understand that. When some of these patients go to their counselors talking about spirits and demons, usually they're just called delusional. And the conversation stops right there. They say that they are not in touch with reality. They think that they are mentally ill, and what they are actually telling you is true. So sometimes we need to listen to these people and also offer them the right kind of healing, because medication and your regular counseling is not going to cure a broken soul or a broken mind. Thank you. Oh, just before I go, read this book, Bipolar. This book has my testimony. I talk about psychosis in this book, and I talk about my experience, but I also have a whole chapter dedicated to schizophrenia. And this will give you more information. Thank you.